See, she's just trying to unmute.
Yep, here I am. Hi.
Hi, Rose.
Any other guests? Okay, going back to board members, Michelle Frederick.
Here.
Thank you, Michelle.
Hi, Michelle.
Hello.
Well, it's great to have all of us together, and even virtually. Nice to see all your faces. As obvious, we don't make it to enough downtown activities to see each other, so it's great to see you, at least through the magic of computers. You were emailed the minutes of the last meeting previously. Is there a motion to approve?
I motion to approve.
Michelle, is there a second?
Second.
Pam, thank you. Is there further discussion on the motion to approve the minutes of the last board meeting? Hearing none, all in favor, aye.
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 Opposed? Motion carries. Thank you. We have no outside guests. We certainly appreciate Rose being here as our guest, but Rose, do you have any comments that you'd like to make prior to your report?
No, not right now.
Okay. Well, for the sake of helping you get on with your life, because I know you're busy also, we'll go ahead and move the FEP nursing reports and communicable disease reports up to the top of the order, and you can give your report now.
Great, thank you. So you guys got my information. So just quickly to go through everything, we are in the midst of working with the local fire departments to have drive-through flu clinics. So saying that, we want that to also tie in with the COVID-19 when that vaccine comes out. We figured it might be cold. We've ordered tents. We're hoping those will come in. And we actually have new coolers coming in, the transfer coolers, because we have to transport those special. So like all of our vaccines. So we're thinking that we can possibly do 2 simultaneously clinics at one time with the COVID, if not more. So we're working on that. Actually, we're meeting Thursday with everybody to try and figure out what's good, what's not good. I'm on the fire chiefs committee meeting. We've reached out to them. They're all in favor for it. So we will reach out. We want to make sure we hit all jurisdictions. So at least the quadrants for flu, and then make sure we hit all for the COVID. So saying that and going forward. So we're going to be working on that.
Rose, could you tell us when you're going to start the flu clinics?
As soon as we get all of our vaccine in.
Okay.
We have not gotten it in. We're actually waiting for the VFC vaccine. We've gotten some flu clinic that we private purchased, but we won't start anything without VFC vaccine.
Okay.
They approved our amounts. We heard they were coming out last week. They were going to approve them last week. We haven't heard anything, so we're hoping by tomorrow we hear something. So that was on the ODH conference call. So going through our stuff, we're just extremely busy with school starting back up and going through the COVID like Joan is. Penny's got her communicable disease report on I think it's the last 2 pages. So do you guys have any questions for me?
I guess the basic question that we all think about and occasionally talk about is the general preparedness and approach that you're using for COVID-19 disease, and how you feel that the response has been.
You know, it's been fairly good. We do have some issues with some people, especially when you have like a multiple people, like an outbreak. So we've had several outbreaks. One of the outbreaks I was working on, she was the secretary and she didn't realize how many people that affected. So it was, and I'm going to just tell you guys, no, I'm not, never mind. I forgot we were on Zoom. So yeah, so they don't realize how this impacts everybody. and how everybody is. Saying that, we have gotten some resistance for people doing contact tracing.
Mm.
And that is really hard. We've gotten a lot of kickback from people not wanting to answer their phones, or they'll answer it the first time, and then when they see our number, they don't answer it anymore. So it's a struggle. It's really a struggle. It's a struggle for our contact tracers who get these people and they yell at them. You know, I've had one last week that I actually took over, and he yelled at me and told me I didn't know what I was doing. But then the next day he called me because he had a question. So you know, it's a struggle. We're trying to do the best that we can. We're still hiring. I think we just hired 6 more, because we know once school hits, I mean, we've already seen it with the few schools that have been in session, the increase that we've had. And it's not so much the increase in cases, it is the contacts.
Mm.
Our contacts went from 56 to over 200
Okay.
within 24 hours. So that's a lot of contacting those people every day. Even though we have the system, it's still a lot, because then if they don't answer it, we have to call them and find out why.
Mm.
So it is a struggle at times. We're trying to do our best. And yeah, I have to agree with Angela. I wish it was over. We've been practicing this and we've been saying this for years, but I didn't think it would take a whole year of our time.
Mm.
Yeah.
Yes, that's where, you know, we always plan for a few months, but you know, this will be for a year, at
Right.
least a year before we get a vaccine.
Yeah.
There's so much follow-up, don't you agree, Rose? That, I
Oh,
mean,
yes,
in the end of quarantine letters, the end of isolation letters, there's just
yes.
perpetual through that cycle,
Right.
updating
So,
ODR.
yeah, you're absolutely right, Joan. So when we get a case, the case gets a letter. When we do their contacts, every contact gets a letter. Ours has it on there when they're potentially able to return to work, and that's if they don't go positive. And then after they're all done with contacts, we send a letter. And we're really strict. We don't send the letter ahead of time. We wait till the day of, before, like the closer to the end date, before they'll get their letter to go back to work. Because I've already had people call me, well, I'm done Sunday. Well, you know, it's only Tuesday. You've got a few days. I just want to make sure I can get my letter. I said, you can call me on the 8, you know, I call it my hotline number because I have a phone. Call me on that and I'll get you your letter on Sunday. So, and then if their emails kick back, then we have to follow up with them with the phone calls. And it's a struggle. And I'm sure Joan's going to agree with this. The numbers aren't always correct when the information that you get, let alone the addresses.
Mm.
So it's a struggle that way too.
There's a
And then
lot of
we also,
investigation.
yeah. And then we also call employers. So if they work, we're calling the employers, and we tread that lightly because of HIPAA, and we actually call human resources of where the employee works. Because I want to make sure that even though it's just one case, that they're following protocol of 6 feet apart, cleaning and everything. And then I pass that information to our environmental health. And then when they inspect, they make sure that they're doing everything correctly. So it's like you're always on the phone constantly, or you'll get some positive test result and it just has a name and a number. Then that's all you have. So
Okay.
calling back the doctor, trying to figure out the lab, you know, and doing all of that and putting that in ODRS. I mean, it sounds easy, but it's very time consuming to answer all of the questions.
Mm.
Because you've got to put all the contacts into ODRS. So all of the contacts with those, I mean, some people, I mean, we just had a house full today of at least 5 in one house. And then that's not including who else she's been exposed to.
Mhm.
So, you know, it is very time consuming.
Rose, have you been able to test most of the contacts?
No, because of the fact they're asymptomatic, no, they will not be tested anywhere. And it doesn't make a difference. And that's just what I tell the contacts. It doesn't make a difference. If you go and get tested and you're negative, you're still in quarantine.
Mhm.
Over and done. Don't waste your
Right.
time.
But the point would be to find the
Yeah.
positives.
Well, we know who the positives are and how they've been exposed to them.
I mean, to find the contacts if there were any positives, the asymptomatic positives. But if
Right.
you don't have the testing capacity, you can't.
Right. And nobody will let them test with asymptomatic. And that's been an issue. But, if you really take your time though and interview the people, you'll find out who the contact was. It's just trying to pull everything out of them. 'Cause some people will tell you their whole life story before they said, well, I went to here and I went here and I work here. Oh yeah, by the way, I went to a baby shower. Or by the way, I went to a funeral. And, then you go through all of that. So it's very, very time consuming.
Mhm. Rose, has there been any change in the symptomology profile?
No, but I'm just going to tell you guys though, we are seeing a lot of gastro illness. It's just a 24-hour thing, and it's just one of my nurses, her kids got it. So it's going through their house. So, and it's just a 24 thing with nausea, vomiting, and diarrhea. But then after 24 hours, it's good. So, Angela, have you seen any gastros illnesses going on with Access Point or anything? Has anybody?
I haven't seen anything that I would think is a viral gastroenteritis. The one gastroenteritis case I had was Giardia. You probably know about that one.
Well, I don't do the
Oh.
thing that the girls do. But it goes
No,
down.
I've not seen a lot of it yet.
Yeah, so there are some, but schools just start, and they had it over the weekend and they weren't even in school yet. So we might start seeing that too as we move forward. So it's good.
Actually, my daughter called me this morning. She was over last night for Labor Day, and she went home this morning and threw up. And she's like, I'm really nauseous and I want you to know. So I feel much better now.
So yeah,
I'm gonna text her after this and be like, you're fine.
yeah, see if she's okay. And that's still another thing, because that still could be COVID, but within 24 hours, they're better. And I'm actually seeing it in a few of the schools that have already started. They're having the diarrheal, excuse me, illness and stuff. So, and they're back in school within 24 hours because they're actually fine. So yeah, and that's going to be our issue moving forward, especially with the flu coming up. So you're, tailing back on that, Chris, we do definitely want to go out and start immunizing as soon as we can. So as soon as we get the VFC, and I heard that the VFC actually got more vaccine than they had previously ordered. So I'm hoping they'll push more out for us.
Great.
And then we'll go ahead and get started with doing the flu clinics. And then Joan, I know my staff is going to come out this week or beginning of next week to tour your new digs you got over there to see how that'll work out for them.
Perfect. All right, just let me know.
Okay, I'll let them know. Okay. Is there anything else? Any questions on my report?
I don't want to be the only one, give you guys a chance to go, but I have a couple of questions.
Absolutely, go for it.
So I love this zip code map that you've created.
Okay, Penny did, yes.
Oh my gosh, it's so helpful. The one question that I have is, would the ODRS be amenable to adding our additional zip codes so that we can distinguish the university from the city and the township from the county, et cetera?
You know what? I know she talked to Joan about that, and I really don't think they can because of the fact the zip code is all the same for the 44240. Is that the same for the school?
No, the university is 44242. And since they're tracking their own cases, I thought it would be helpful in the ODRS system, and especially for you and Joan, to be able to see what's different
I will
university
see.
wide.
Okay, I will see because I'll see what we could do with that. So now saying that, so the university is tracking their own, so they do the contact tracing and everything?
Well, through Joan, they're doing it. Joan is overseeing because she's short-staffed at the moment during the move. The university is volunteering their people to help Joan do the contact tracing. But
Okay.
the president wanted to have a dashboard on the website indicating what the individual Kent State cases were relative to the city so that people could see the differences that were concerned. And that's why I thought it would be helpful in ODRS to identify the university separately from the city.
I
Now,
think
I know that all the schools have to report. I'm not sure if that's K through 12 or if that includes universities. There's a special, I don't want to say it's a website, but they have to report everything to ODH. So I am not sure if that is actually even the universities. We actually got the algorithms that they have to report that one out. So I'll have to see. So they should be able to report and have this. So I will ask Penny about that and I will get back to you. Okay, Chris?
Thank you, Rose, because I'll tell you, it would be so helpful to see that separate dot on this map.
Yeah, we will not report, well, it goes by color as you can see.
Right.
So, and that little gray area or the green area in the middle of 44240,
Uh-huh.
that might be it. But I will double check because I don't, how many cases does KSU have?
on campus, it's very few.
Yeah,
The
there's
majority are off campus, yeah.
And that little
think that the
green
current
light
rate-
might be the 1-2-30.
So yeah, that, I think there's a 44242 and a 44243. But it might take some refinement on our part to make sure that we're getting in that right zip code so that then it can come up and we're not just automatically entering a 442.
Right. Yeah, and that might be the whole issue is if that, if you're not entering the correct zip code. So I will check that out with Penny and let you know, Chris. But
Thank
it's
you.
going to be too, she's pulling it from ODRS, so they have to make sure that they enter that information correctly, because
Okay.
that's the big trick and that's the big hurdle that we have all the time with not just, any case, it's any case. We have so much.
I just was thinking that it might be a case where anything that comes in as 44242 automatically gets converted into 44240. And that would dilute the university cases into the city cases and not
Yeah.
keep an accurate record.
Yeah, you know what? I will definitely check with Penny and we'll see if there's something we can do.
Thank you.
Rose, did you say
Yeah.
there was a 44243?
I think
Joan
I
said-
said that.
No, it was, yeah, Joan said that.
Okay. Alrighty.
So you want to know what that is, Pam?
Yeah, I'm not sure what 44243 would even be.
I've seen it come up occasionally, and I was kind of shocked the first couple times. I didn't realize that there was a zip that was 44243.
Interesting.
Yeah, I don't know what that is.
I don't either.
I don't, so Joan, I just have a question for you. When you enter the 44242 in and you do the verification, the validation, does it change that zip code?
It might. I'd have to go back and look because there have been very few on campus itself.
Yeah,
Interesting. It does show it. I don't know how valid this is. If you just Google it, it does come up in I don't know about these websites. It does come up as a Kent zip code. I've never seen it. Interesting. Okay.
so yeah, we'll check those out, but I will check with Penny and see what she says. But it's gonna
Okay.
have to depend on who's entering that information in.
Yeah.
And then we can capture it that way.
Super. Thank you very much, Rose.
Oh, you're welcome.
Are there other questions for Rose and her reports?
Rose, real quick, you said you have an ODH team of contact tracers. How's that going?
It's actually going really good. And then we have our contact tracers. So we're having like a Zoom meeting tomorrow. So with our contact tracers and ODH's contact tracers. It was so funny because when we started with ODH contact tracers, their system that they use, we can see them hovering over as we're putting them on the spreadsheet. They're like taking them. I mean, we don't even have all of the information in, and they're already got their name assigned to them.
Wow.
So it was, it's been really good, and it's been really good having the system that they're letting us use, because it's all, we can all go in at one time. We can all pull our information out that we need. We can update, we mark in there. So what we have is we have a contact and a positive case spreadsheet. We have a positive case spreadsheet. We have monitoring questions. So they can put a question in for a nurse to answer, the contact tracer, like, please call this person, she's still having signs or symptoms. And then we can go ahead and find this information out. Now they're also do the OCTS. So they're monitoring those, and they're updating OCTS, and I want notes in OCTS. So those notes follow through. And then we have another spreadsheet that for their information. So we just go through, it has their names, their cell phone numbers, and their email addresses. And that way everybody has it together.
And did they give you that team for as long as you need them?
Yes, and it's free.
Wow. Yeah.
You have to sign up for them, but they're free. And it was like, I think in like in March or April, the state put a big rollout on
Yeah.
getting the contact
I know
tracer.
they kept promising it. Great.
Right,
Thank
yeah.
you.
So once we got real overwhelmed, we reached out and we got 3, and there's actually more coming in that they're training, and they're using our site to train.
Wow.
Super.
Thank you.
You're welcome. Any other questions?
I have a quick question, Rose. With some of the contract tracing that you're doing, what is like the average length of symptoms are you seeing? Are you seeing people that are pretty symptomatic for a longer period of time, or what is that looking like lately?
For the confirmed cases or the contacts?
The confirmed cases.
Confirmed cases, it really depends on the person. It seems like the elderly or sicker, but not all the time, because it's like the younger seem to get the headache. The headache can last like 3 to 4 days, if not longer. Now, this is a headache. I don't have migraines, so I don't know. I'm attributing it to like a migraine, but nothing will help this headache go away. Tylenol, Advil, nothing. And then they get the body aches, and the body aches, and then they get the fatigue. And this is when we talk to them, we say, you know your body, rest. Just rest. Don't worry about it. We know we have some people that will take advantage of the 10-day quarantine and want to expand it out to 30 days, but we don't. If we'll go like 2 or 3 days longer, and we'll say, if you're still having symptoms, we want you to see your primary care physician. So, because they could have something else going on, and we've had that before.
Right.
So it really depends. With people, we have one person who's like in her 40s, and she's hospitalized, and she's been in there for a while. So it really just depends on what their symptoms are and stuff like that. But for the young people, this is what we're seeing, is more of the headache, the fatigueness, and also just the body aches. And no fevers. Not one had a fever. So, and that's what makes it so rough.
Right.
Anything else for Joan?
Anything else?
Joan, as usual, thank you so much for joining our meeting.
Rose.
And,
Joan, I'm Joan.
oh, I'm sorry. I'm looking at Joan, and then I'm saying Rose. In my head, I'm saying Rose. Sorry, Rose, thank you so much.
Okay. Oh, you're welcome. Thanks, guys. Have a good night.
You as well. Take care.
Thanks.
Sorry, Joan.
That's okay. That's
I was
all right.
looking right at you, and because you're like in my screen right there. Now I'm back to the Brady Bunch model.
Right.
All right, having heard the reports, is there anything that the board would like to discuss, hearing what Rose had presented? Okay. Joan, any comments?
No, I would just say that in terms of some of the younger people, the 20 age group that does seem to have a fever, it's purely anecdotal because the numbers are small, but those tend to be the people who also admit to vaping. Because I do try to ask that question about vaping and smoking and try to do a little work in terms of cessation. Not all of them are even in the contemplative state of considering quitting. But I have noticed some of the sicker individuals, do admit to vaping. So I think that that's also an important link to make. And I know we've done a lot of social media on that as well.
That's good to know. Thanks. Statistical report for August. Any highlights, Joan?
No, I believe that was in the packet. The one thing that is down considerably is the MAC claiming time from this time period last year. But I think that we've right-sized our MAC claiming, so it's actually more accurate than it may have been in the past. So we are going to work on getting those numbers up, and I think as soon as COVID moves on, we'll be able to do some of those things that will allow the MAC claiming hours to increase.
Great, thank you. Any questions for Joan on the statistical report? Hearing none. Joan, your commissioner's report, please.
Okay, so we'll start with just a brief COVID update. We're currently up to 168, that's 168 cases, no deaths reported in our jurisdiction. In terms of contact tracing, we have the 1.3 FTEs, which are spread between 3 individuals. And I also did reach out to the Ohio Department of Health, and there are 3 additional contact tracers that are working with our team at this time, because I could just see that with the university and the school coming back in, that they would be a valuable resource to have. And we are using SharePoint much as Rose had described. It's a great communication tool, a great way to see who's working on what and where that patient is in the process of their isolation or their quarantine. In terms of ages, I just think in the last 10 days, we've had between a 6-year-old and a 73-year-old, but far and away, the majority are in that 20-year-old age range. And the majority of those are Kent State off-campus students. So I think that there's some concern there in terms of choices of behaviors, whether that's mask wearing, gatherings. We've heard a number of people that have actually traveled to other states to meet with friends where the school where they go to and have either took it there and brought it back. So there's a number of gatherings that seem to be associated. We did end up getting an outbreak number assigned from the Ohio Department of Health for Kent State for the off-campus. And then should we need an on-campus outbreak number, we'll look for that too. And I'm sure that would be assigned should the need arise. We're having ongoing discussions with Kent State. They have a daily huddle that they have very kindly included me in on that. So I get to hear a brief update on what their last 24 hours and their next 24-hour look ahead might entail. You're probably aware in terms of the health alert advisory system that the governor put into place that the county was downgraded from an orange level 2 to a yellow level 1. So I think that that's good news. I believe that our positivity rate for the state has decreased to 3%. So hopefully that will mean that some of the interventions are actually helping and we'll start to see fewer cases. In terms of Portage County, of the 7 key indicators that can change a county from one level to the next, we're only meeting in one, and that's the non-congregate care settings in terms of those new cases. But the rest in terms of ICU admits, overall hospital admits, outpatient visits, ED visits, numbers of new cases per capita, and the increase in new cases, those are areas that are not being met. So that's a great sign. In terms of the 21-day average too, there have been, we're less than the 21-day average today, but some are kind of trending up, although they're still underneath. We did have a second family where English was not their primary language, and so some difficulties in doing the contact tracing there, but we did reach out and do have interpreter services to help with that, but that was again a multi-generational family, and there was concern there for spread. So in terms of the return to school for the K through 12, I did receive a sports plan from the school system and reviewed that and just had some minimal suggestions. I think they had most of the bases covered there. In terms of the university level, again, it's more along the cases and the divide between the on-campus versus the off-campus. And I believe I already touched on underserved populations with that second family, that the language barrier was there. In terms of testing in long-term care and assisted living facilities, we have one that falls in each. There's an assisted living facility that has a long-term care portion and a memory care, so that doesn't fall under the bi-weekly schedule that our other facility does. So they tested last week. Also, I believe it was over 70 individuals tested, and they all tested negative, which was phenomenal. But they also shared that they received a point of care test unit so that they can run their own samples after they're collected. They can run their own samples there. I did ask the individual, the general manager of that facility, if that was under, whose CLIA license that was under and what the training would be, because that's going to be so important to make sure that the preventative maintenance is done, that the people are trained adequately on the reagents and how to run that test. And they said they haven't started using it yet. They had some additional questions, so I believe that they'll look into that. In terms of compliance checks for bars and restaurants, we have ongoing social media, media asking about those public records. We did not do any checks over the weekend. I did hear kind of peripherally that with the closures of the streets in downtown, people love it. It's helped business boom, but I'm just concerned that there may be some issues with overcrowding. So we'll be making some plans to head back downtown to do some additional bar rounding. With the Safer Business pledges, we did make that ask of the city departments to also sign up for those. And so I believe we've seen increased applicants for that as well. I think that there were just 7 prior, but we may be close to doubling that. And Mike, I don't know if you want to add anything about the Safer Business pledge.
I would encourage you, if you haven't, to let businesses know about the pledge. I reached out to Main Street Kent and they haven't answered me about that yet, but we want to get as many people signed up as possible. I know the city is not concerned, or maybe they are, but they really want to push business and local business and make sure that people feel comfortable going downtown and are more active downtown, but they want to do it safely. And the pledge allows these businesses to put forward that they're following the rules, most public health guidelines. So we would just like some more businesses to be active in taking that pledge. We do have a couple downtown that have taken it, but we also at one point only had 5 signed up, and one was a cemetery and one was a funeral home. So we definitely want to push that as much as we possibly can to those restaurants and the downtown retail.
And I think there are quite a number of businesses that are really trying to attend to those safe practices. And so we want to encourage them. If you're doing the work, have the accolades for it. So that's important. So hopefully we'll see some increased usage there. In terms of our move to PARTA, we've been here over a week now, still trying to get things established and organized. We need to install our plexiglass at the reception area so that we can start allowing the public to come back in. At this point, we are still closed to walk-in visits. The other thing is our sign is supposed to go up tomorrow. So I want to make sure we get outside and take some pictures of that sign going up. I think that will help the wayfinding quite a bit. We did, advertising, but people are still going to the old building and being a little bit confused about where to go. So I'm hoping that will help. And we may need to then do some more advertising that, we're here now. And certainly when we open to the public, we'll do a big push there. With the mosquito EPA grant, we were notified by the Ohio Department of Health that we had 2 of our pools test positive for West Nile virus. And I guess that's not a surprise. We've had them test positive in the past. It is in northeastern Ohio. No cases of encephalitis have been reported as a result of that. And just to know that there was a 30-day turnaround, Mike did a really nice job posting that press release. It was one of the most trafficked social media posts that we have put out in, I think, our history of putting those posts out. And I don't know if people are just so weary of hearing about anything that's health related that I think there was a little bit of distraught. But we are going to retest 2 of the pools, and then we're also going that we're positive, and we're going to retest 2 random pools kind of as controls. And the other thing we talked about in the department was, because in the previous samples that were sent down, we sent down samples from 6 different pools, and of course all those were lost. So it could have been that any number of those pools were positive, but we just never got the results to know. But we'll continue. And of course, treatment will be a big part of that plan as well.
Were the positive pools, Joan, in the same sectors as the previous years?
One was in Jesse Smith Park, which I think had been positive in the past, but the other was a little bit surprising, was Kramer Fields, which had not been positive in the past that I recalled. So yeah, and that's a busy place with all the sporting events that go on down there. So good that we didn't have any cases transmitted.
Right.
In terms of our FSOs, our food service organizations, of course, Franklin and Erie streets have been blocked off. They were blocked off 3 days this weekend, and we again saw increased business, which I think the restaurant and bar owners are very pleased with. I think people like the atmosphere of being outside. There's a nice historic vibe. The buildings are nice to be outside, but I'm not sure how long that'll be sustained with weather changing and things like that. But I am concerned that maybe there is overcrowding with people liking the area and liking the tables out there. That I am concerned about. Is the proper cleaning going on? Are we, overcrowding that area? So so we'll continue to monitor. And again, when we go to make our rounds, we'll try to incorporate that as well. And then we will be returning to the long-term care facilities for their kitchen inspections. Those are licensed facilities. We had just made calls during the initial inspections were due like in March and April, but we put them off because of COVID. We wanted to try to limit our staff's exposure, but we also wanted to try to limit exposure to that vulnerable population. We didn't want to be going into these areas. So we did telephone calls instead of in-person visits. Now we'll make those in-person visits and follow up. In terms of housing inspections, those are continuing to roll out. There was one concern for owner-occupied or alleged owner-occupied rental unit. And if the owner lives there, then it doesn't have to be inspected. But there is some suspicion that the owner does in fact not live at that residence, and so it should be inspected. But there's been some issues with gaining access to do the inspection and also to verify the address, because if he or she can verify that they truly do live there, then we won't pursue that inspection. In terms of pool inspections, we have had one property that has had a significant problem over the last 2 months, and Justin has been going out repeatedly to do education, to do follow-up visits. He's been spending a lot of time and effort there, but the problems don't seem to improve. He did ask for because of the lack of chlorine and the testing not being done correctly, he did ask for the pool to be closed. He did go back then to see if they had made the corrections, but he was not allowed on site. And by that, the inspectors are allowed to have 30-minute leeway, and then they should have full access. And the way the ordinance is read is if you're not permitted that 30-minute access, then it's the same as saying your pool is out of violation. He did follow up with the owner today, and they said, we've already closed the pool. It's the end of the season. The pool is shut. But it was so significant and so egregious that we are concerned about that, and that the pool is being used even though it is supposed to be shut. Justin did ask, are there signs up? And if the signs are up, individuals may be taking them down and using the pool anyway. So I think we'll have to do some additional follow-up there in terms of just making a random visit to see as the weather continues to be nice in September, even though the pool may be closed, as long as there's water in it, people may be still using it, even though the chemicals are completely imbalanced. And evidently, individuals who reside at this complex have been filling the pool with a garden hose. So they intend to use it regardless of the condition of the pool. So that's somewhat concerning as well. And I believe that that's all I have for my director's report this evening.
I never fail to be amazed. A garden hose.
Yeah.
Wow.
No treatment, yeah.
I love Kent.
Yeah.
Right. Questions for Joan? Well, you're a quiet bunch this meeting.
I just, no questions, but Joan, just thanking you and Mike and your team. I just often think about everything that hit since you agreed to leave our board and join us as commissioner. So thank you for the work that you guys are doing, because it's not really unprecedented times, but certainly currently unprecedented times. So thank you.
Oh, thank you. And I will certainly share that with the staff, because they are trying to keep up the same level as pre-COVID times, because they take a lot of pride and are very engaged in their work, and they want to make sure that that these various venues are safe for anybody who uses them. So.
You know what, John, I did have a question. With the outdoor dining that's going on downtown, who is responsible for like cleaning the tables and things like that? Is that one particular group, or is that?
We had a lot of discussions about how that would roll out, because I would be the one that would be saying we need to have somebody out there managing the cleaning. But
Right.
that was a little bit cost prohibitive. So the supplies are there for individuals
Okay.
to clean. And so certainly if I was going to go use a table there, I think I would clean it off before I would sit down. I wouldn't count on the person before me cleaning up after them as much as I would count on myself to clean it before I sat down.
Right. Okay.
Those supplies are supposed to be there. And then there's 2 hand hygiene stations that will have running water and will be connected to the sewer, so that people can actually wash their hands with soap and running water as well. So 2 of those will be down there.
Okay. That's good.
Down there this weekend. Yeah. But yeah, that's a concern. That's one of the other things I asked, because some of the wooden picnic tables, those are hard to clean.
Right.
A little bit weathered, and it's hard to clean wood well. So I did ask for some plastic coverings to be put on, but then there was concern that they'd be ripped or torn, and then those would be equally hard to clean. But evidently some people have been bringing their own like oilcloth table covers or plastic covers. And I think, that's a great idea too. I just want to always be careful about the trash and the waste though, but hopefully people would bring the type of tablecloth they might want to reuse. So take it home and clean it and then bring it back again. That could be their picnic cloth table. Yeah.
It's actually a good idea. Had any information through social media been put out to recommend that people bring their own?
I know we have not done that, but that was actually an idea that I thought early on, like when you bought your meal, they would maybe give you a tablecloth that you could put down, and it could have advertisements, or it could have, the reasons why we're social distancing, or doing the things that we're doing, encouraging mask use after you finish your meal, those kind of things. But I think it was a little cost prohibitive.
Okay.
So.
Anything else for Joan? Okay, thank you, Joan. We have a couple of discussion items. I think most of these are pretty straightforward. We've heard some of the background information already, but Joan, would you kick us off with the school reopening items?
So I'm just seeing what has happened with the university reopening, and about a week or 10 days later, we start to see cases spike. I'm kind of looking for that same thing in the K through 12. Already we've had a couple of cases. They have not been in Kent City residents, but in non-Kent City residents. So those are not in our jurisdiction. So, but I look for some additional cases in that school setting, also working not only with Kent City schools, but with St. Patrick's schools as well. So just we'll keep an eye on that and try to, just work one-on-one with them. In terms of each situation is a little bit different. And with the school reporting, with those numbers, I think that will be important, that they understand how to report and what to report, and when to get those numbers in, so that we can keep that updated. I know that there's a lot of concern from the university side in terms of so many of the cases being an off-campus and what can the city do in terms of enforcement. But we've been through all those channels, and there's really, there's not a good avenue for that. I don't know outside of school codes of conduct. Some schools I know have fined or suspended students. I don't know that same approach is how, Kent wants to handle that, but certainly I don't have the means to cite. So we can only cite if there's, underage drinking or if there's loud noise. So if it kind of supersedes or goes against the ordinances that are already in place for that. So they did say overall, the police department said overall, the numbers of complaints and numbers of large parties seem to be reduced compared to last year. But in terms of the spread, I don't think, we don't need to have parties of 500 to have spread. We can have parties with handfuls of individuals, and there can be decent spread going on. And that's what we're seeing with the contact tracing, is that there's a lot of overlapping contacts. So that people have somehow gotten together because they have different addresses, but they have the same few contacts. A couple of very popular individuals, I guess, going from spot to spot.
Joan, this probably would do nothing, but I'm still going to mention it. But could there be any power at all in reaching out to landlords and asking them to encourage their tenants to behave responsibly? And/or, I don't know, Chris, about through the university, the Greek organizations, asking them to encourage their members, because the Greek organizations, at least the sororities, I don't know about the frats, they may have a code of conduct, and just encouraging them to encourage their members accordingly.
And I know from the canvassing we've done, and I reached Dennis, his last name is slipping my mind, but he's with the Interfraternity Council on campus. Yeah. I know that he said the national organizations have been very clear that they don't want their local chapters to be the cause of outbreaks, and they want them to be the role models and that. But there are some concerns about cases in sororities as well as fraternities already. And certainly when they get these ordinances from the police for noise and underage drinking, as that escalates, then the landlord can go ahead and work on eviction if they so choose. So that is an option as well. Yeah.
Joan, and our fraternities and sororities also have local board, I forget what it's called, it's been so long. I'm a Delta Gamma, but it's been obviously a long time. But there is a local housing board, like the DGs have a local board of alumni that oversee that house, and they're local. And so we could also identify the board members for the frats and the sororities and reach out to them, because they will respond to that.
And I know we did have a very concerned community member that reached out to city council that said, we should just close all the sororities and fraternities down like some other schools have done. But I think because this is a public school and those are privately held and they're actually off campus, that the school can't just come and shut those down.
The only thing the university can do is deem them not a university affiliated organization, but they can't actually shut them down. But their boards can, and their boards have for challenges previously. So they can.
So that might be a means to reach out. I know I have my housing list of where all the fraternities and sororities are listed. So every time we get a positive, I double check against that list so that when we do the contact calling, we'll ask, are you a member of a fraternity or a sorority? And sometimes they'll say yes, and sometimes they'll say no. And I'll be like, well, your address is that of a fraternity. Do you want to change that answer? So I think sometimes they don't realize that the health department also covers those multi-unit apartment and rental units. So
that's good questions, Pam. Anything else for Joan on the school reopenings?
Yeah.
Okay, she's already introduced the next topic, so I'll let her give you the skinny on the new digs.
So again, I think I fairly well covered that in the director's report as I did with the street closings. The one thing that I was concerned with was city council had made some changes with terms of boards and committees. They were concerned that there should be some consistency in terms of the length of membership between 3 and 5 years, and then not allowing people to be on multiple committees or boards at the same time. I was concerned how that might affect us, but they said because the school board is different than a city board, that would not. But I think I have to get some further clarification, and Jack, feel free to jump in. But I don't know, we're chartered, so I don't know if they could really change our term limits in terms of decreasing ours from 5 to 3 years like they did the others.
No, we are chartered. All of the requirements for the health board are in the charter, and so that must be followed. The other commissions and boards are not in the charter. I think we may be the only one that has charter requirements. I think the only thing that we might have to obey is, I think all terms now end in December, Joan, if I'm correct, but we're only allowed 2 consecutive terms. Is that what it is now, too?
I believe.
And a year off.
Yeah, a year off. But all that stuff stays the same. So we were one of the boards that were not affected by the changes, so.
And I think that's important to note because Louise just got reapproved. She had her short little term and now you're on a full term. So congratulations, Louise. We're glad to have you back and have you back on a more permanent basis. Okay, so I just wanted to make sure, especially when they had that no sitting on 2 boards simultaneously. And
that will affect us. I mean, none of us can probably sit on 2. I mean, I wouldn't, but what we found out is that we have people sitting on more than one board, and it really isn't fair. And sometimes it actually gives them more power than probably what they should have. So.
I mean, now I do. I mean, you know that. I'm not feeling very powerful, but I'll just say it.
I don't think the school board counts, Pam, and I don't think we count in that. So
I think it's different since that's an elected position.
Right.
I think that there's the difference because I know when I ran for school board before I did it, the health board did the research to make sure it was okay. But just to make sure that hasn't changed.
Yeah,
no, you're okay. And I'm on city council. I mean, I know I'm the appointment, but I'm still a member of the board.
Right.
And I'm the only member of city council that sits on a board that has voting power. So, but that's according to the charter.
Right.
Yeah.
You know, it's a interesting situation to be in because historically, at least with the Board of Health, because I mean, again, I've been on it, for a long period and sitting out a year here and there. There have been times, remember, Chris, when we couldn't even find people that wanted to be a part of it.
Oh, yeah.
And we, for quite long periods of time, we had openings that, we were looking for qualified people or anybody to participate.
And they have lasted a year or more.
Yeah, I was going to say, I thought so also. It's been a while. So I really would say too, it's that the advent of the School of Public Health and all of that, and that atmosphere in the community has really helped. But anyhow, okay.
We've actually had to delete some committees because there was no interest, and actually the committees didn't function anymore, like the cable committee.
Yeah.
Well, there's only one cable company and there's no power there. Let me just tell you. They have all the power. We have no power.
Yeah.
You mean you can't get the price lowered?
No, isn't that surprising?
What?
All right. Joan, anything else in your discussion item list that you want to bring up?
No, I was going to bring up that zip code map, but since we already touched on that, that's all. Just one thing I would mention is that because of the jurisdiction and the way the zip code goes, it does look like we have more cases because it encompasses Franklin Township, which is not truly part of our jurisdiction, but because it shares that zip code, the numbers are higher on the zip code map than they are in actuality. So that I thought might be important in case a community member asked you as a Board of Health, well, why does your social media say it's this number, but the zip code map says it's something else? So that's why there's that discrepancy.
It also includes some of Brimfield as well, right? Since that has a 4424, yeah.
So,
Jack, was that because of the assignment of postal services?
Yes.
Okay.
A lot of Brimfield is 44. I think maybe all of Brimfield is 44240. So
Okay.
I think some of Brimfield is in Wordstown, but.
it's in
Yeah.
Wordstown,
Mhm.
but a
Or
lot,
Ravenna, whatever Ravenna zip code is, 44266.
but a lot of it up
In
through
part.
I know through Talmadge Road and that area is 44240. So they're also on our zip code. So it's kind of confusing. So,
I hope they can figure that out.
yeah.
All right, we have a couple of action items. So moving on, you have in your packet the expenditures and encumbrances for August. Is there a motion to approve?
So moved.
Thank you, Pam. A second?
Second.
Thanks, Emily. Any discussion on the motion? I see we had one decedent that needed to be housed.
yes, so that would make our third for the year. There was the fourth, but the funeral home did a little bit of research and found that there was a family member and that the individual actually owned a home. So they weren't truly indigent. They just needed to be able to work through the courts to get that. And so they did not need to be taken care of in that way. So we're up to our third case this year.
All right, good, thank you. Hearing none other is, we'll go ahead and vote. All in favor of the motion to approve the expenditures and encumbrances for August 2020, say aye.
Aye.
Aye. Opposed, same sign. Motion carries. Joan, you want to give us a brief intro to the 24/7 contact?
Sure. So I think that that's actually a policy that Mike was looking at. That's something that we have to have not only for FAB, but it just makes sense that we have a means and a way to contact in terms of an emergency. Not that we're not already functioning in an emergency, but additional things could happen where we would need to reach out and know who to get a hold of next. So Mike, do you want to share any background on that then and what might have changed with that SOP?
Sure. So the main change to the policy is that we've added, or rather I've added a chart for a call down list. It's something that the other health departments that I've looked at who've had this document successful for accreditation for the future, they had a call down list with phone numbers. They also had action steps in the event that there are late night calls for example, Class A reportable diseases or other public health emergencies of who gets called. Now, our document was fine the last time. It simply said that any call will go to the health commissioner, and then the health commissioner will delegate that information after that. However, I think it's better to have more fleshed out SOP of if we get a fax, then what happens? If we get an email, what happens? If we get a inquiry via social media, then who does that go to first? And then have that call down list. So those are the big changes. And then I've included also some action steps. They will have to be refined as the action steps that I have created include a 24/7 sort of phone line, as in a staff will man the phone for that 1 week, and they will be the ones that will respond to calls, and then they will delegate it to the health commissioner. So there's some refinement because this was more geared towards a larger health department where they could be getting dozens of calls at any given time. So something that we may have to just flesh out a little bit further here. But I did include some action steps, and then I have the call tree as well as part of this policy.
So, Joan, do you want to keep that internal as an SOP as opposed to a board approved item? You're mute.
Thank
There
you.
you go. Yeah.
So, yeah, I had not thought about that, but I think probably internal.
Yeah. This way you can change it more frequently as you need to without board approval.
Okay.
Very good. Is there a need for an executive session? Hearing none. Any information for the good of the order?
Actually, I would like to just let everyone know, I did have a meeting with the Fair Housing Committee because I'm the appointee from our board.
Great.
And their only issue that they were talking about was, of course, the Trump overrule on Obama's housing, the AFF for fair housing. And so that was the only issue that they discussed for that meeting, just so everyone's in the know. So their idea was to write a letter to a congressman that they did not approve of Trump's overturning Obama for fair housing, which kind of went in line with our public housing ruling for that we just voted on recently. So I thought that kind of went in line.
Thank you, Michelle. Appreciate you serving on that committee. Anything else for the good of the order?
Yeah, Chris, I'll make one more quick comment. Just to comment on COVID fatigue, which many of us are feeling in the community as well as here at the health department. I posted our numbers for the city on September 1st, and that reached a total of around 300 people on social media. The West Nile virus press release reached 52,773 people, was shared 563 times, and engaged almost 8,000 times. So if we'd like to talk about COVID fatigue, I think that there is some COVID fatigue in people caring about these numbers and caring about the statistics that I update twice a week. And a lot of the education that I push too. I had posted a infographic that had a traffic light theme that talked about things to avoid, things that you should be cautious about, and then things that are safe to do. That only reached 170 people. So, you know, it's important that I keep posting, keep making, and we as the department keep pushing all these safe public health guidelines and practices. But I think we're starting to hit a brick wall in terms of reaching the people that we need to reach and making sure that they're understanding of the increased risk that is here with the population increasing in the city. So I just wanted to comment on that. The social media, and maybe at the end of the year, I'll give a full update about how much our pages have grown, because it's exponential growth. It's not small gains. It's, you know, quintupling our numbers in some cases. So I just wanted to comment on the COVID fatigue that I think the community is sort of seeing. So I'm trying to push some other materials that I think are just as important, if not more important, and those include seeking out mental health services and making sure that if people need an outlet to speak their mind and speak to a professional and make sure that they get the help that they need, that there are resources out there and there are people willing and ready to help.
Thank you, Michael. That's a good point. I have two thoughts. Number one, I'll say real quickly, September is National Suicide Awareness Month. So it seems to me that you would be doing so many people a great service by advertising places for people to speak with healthcare professionals who can provide that mental health distraction to help them be comforted. And then certainly the links to the mental health agencies where they can get treatment. So I appreciate you continuing to do that. The second item, which struck me as you were giving the statistics, is that the number of visits for West Nile far exceeds the population of the city of Kent. And so I'm wondering who's looking at these statistics and why?
Well, I think especially with regards to mosquitoes, you know, we're not the only place that has West Nile positivity. We just got it a little bit later because of the lost specimens that were sent down. So it's a good question. I don't know where those numbers are coming from. I'm trying to quickly see if I could find a graph here on our Facebook page. It's a good question. I don't know. I think people see a health concern and think, great, chalk it up to 2020 again. You know, just continuing to be a downpour of bad news. But I guess I don't have a clear answer. I did include Jesse Smith Park and Kramer Field in that press release. Maybe that had something else to do with it. I'm not really sure.
But
Well, I
yeah,
appreciate-
nobody mentioned the locations, but people just mentioned the positivity and they're concerned, why aren't you treating? You know, what else do you expect us to handle when we're already overloaded with information? So, and nobody seemed to be concerned about the location so much as just the positivity of the pools.
Right. Well, I think to your point earlier, Joan, simply reiterating that this is our annual West Nile positive caseload, that we continue to do larvicide in this early spring, and we continue to do adulticiding as we find these positive cases. I think that's really good positive feedback for people to understand that we're prepared to do mitigation as we're alerted to the presence of the mosquitoes.
Absolutely. Thank you.
Thank you. I already asked for an executive order and found none, no reason. So is there a motion to adjourn?
So moved.
Thank you. Is there a second?
Second.
Thank you. We stand adjourned. As usual, I really appreciate your efforts and your willingness to be on this board and to take the seriousness of all of these issues at hand. And so I wish that you continue to be safe and healthy, and we'll get together again next month.
Thank you. Thank you all for your time.
Thank
Take
you.
care.
Bye.